I'm Samantha Davis. I'm the manager here on One Day Surgery and PACU. We're going to show you around today and tell you a little bit about what we do. One Day has about 25 employees and PACU has about 20. We're open Monday through Friday from 5 a.m. to midnight, and then we have weekend call to take care of those patients on the weekends that need our help. We typically see about 55 patients a day. We've had a record month this month in August where we've seen about 1,300 total so far. One Day services surgery, of course, inpatient and outpatient, and then we do outpatient GI lab and outpatient interventional radiology. Typically, our day starts out in the preoperative area. Our nursing ratio at that point is 1-to-1. It usually takes us about 30 to 45 minutes to get a patient ready for surgery. So we ask pre-op questions, we do a full body assessment, start their IV or IVs if they need more than one, give pre-op medicines, antibiotics, that sort of thing. We also do our own morning of EKGs. We can do lab work here in our own department. We have a ChemStat machine, and we do morning of pregnancy tests for the women that need those. We have become pretty self-sufficient. It's pretty great. The nurses do a really great job with that. We work closely with the anesthesia team. They come in and see our patients after we get done with their questionnaires and get them ready for surgery, and then the surgeons come in and then they go off to surgery. After that, that's where they go to the PACU, and Autumn will give us a little bit more information about that.
Hello, my name's Autumn Chipman. I'm the clinical coordinator for PACU. I've currently been here for 13 years and loved every minute of it. We have 20 employees. We receive patients from surgery, usually general, sometimes moderate sedation. We keep them for typically 1 hour afterwards. We are a 1 to 2 patient ratio. Like I said, we've got 20 staff members. We are staffed Monday through Friday with call, nights, and weekends. And another thing, one of the deciding factors regarding our patient being stable enough to return to their next destination would be the PAR score. We strive for a PAR score of 8 out of 10 or greater. While the patient is in recovery, they are under the care of the anesthesiologist. We have a preset order set that covers narcotics, reversal agents, albuterol therapy, and nausea. But we work very closely with anesthesia, and we take good care of our patients.
Once they part out of Autumn's PACU state, the patients will either go back to their room if they're inpatient, but we have a lot of patients that go home the same day after their surgery, so that's called phase 2 recovery. They come back to One Day Surgery for that, so we've got a fully separate team that takes care of them for that, and then they have to par out, and it says that their breathing is good, their pain is under control, their nausea is under control, and they've met requirements that will make it able for them to care for themselves at home. So once we determine that they're ready to go home, we go over discharge instructions, and that goes over driving, any kind of restrictions that they may have, and follow-up appointments with their doctor. So we try to make sure that they're really well taken care of, as well as prepared for going home and taking care of themselves once they get there. And we give them numbers just to call us back just in case they need anything after that. So that's about what we do. It's a very, very busy day in One Day Surgery and PACU. Our team is great though. We work well together, work well with our surgeons and our anesthesiologist. We're very lucky to have a good team. I hope that gave you a little bit of insight on what our day looks like, and we're glad to have you. Thank you.